right, so we'll go ahead and start. We're thrilled to have you join the Treatment and Recovery Resource Meeting. This meeting is a product of the Treatment and Recovery Committee for the Governor's Alabama Opioid Overdose and Addiction Council. These virtual calls are designed to provide valuable insights, resources, and support for professionals involved in helping someone gain access to treatment and recovery resources. Each meeting will feature three dynamic speakers representing different organizations who will share the resources they have available to support our important work in the field of treatment and recovery. These meetings will occur on the first and third Wednesday of every month at 12 p.m., so please continue to join us as they occur throughout the year and feature new agencies with each meeting. The Zoom link will remain the same for each meeting this calendar year. Each agency will have 15 minutes to share about their services and referrals, followed by 5 minutes for any questions our attendees may have. We ask that all participants remain muted during the presentations. We will open up for Q&A. You can unmute that and ask any questions you have, or you can ask them in the chat, and we will ask them for you. Without further delay, I'm excited to introduce the three agencies for today, which are Bradford, Restoration Springs, and Partnership for Drug-Free Community. So we'll go ahead and start with Bradford. I don't know if we can hear you.
Is it because I'm not close enough to the mic?
Okay, that's better, yes.
Let me see. I think it should. I'll just lean into the camera or into the laptop. So again, I'm Kendra Holmesley with Bradford at Warrior. I'm a territory manager. I'm going to throw my cell phone number in the chat real quick before we get started because I don't want to forget. And what I do is I work as a point of contact. If you have a referral that needs treatment, you can call me directly to the client. And we provide substance abuse treatment. So I'm going to do a screen share. I think I have permissions to do that. I have a little presentation. Another one. So this is, as I go through this presentation, this will act as kind of a virtual tour of our Warrior campus.
Okay, we can hear you now.
Oh, you can hear me?
Now we can, yes.
I wonder. Okay, well, I'll just lean in. Let me know if you can't. I do have a webcam I could try to use that might have a better microphone than the laptop. Or maybe if I hold it up level with my face. Y'all just ignore the close-up you got there. So, this is our campus at Warrior, which is just north of Birmingham. Bradford Health Services, we provide substance abuse treatment at every level of care. And what that means is we have from detox to inpatient residential. We have inpatient residential long-term treatment. And then we have our partial hospitalization programs. Our IOP, which is intensive outpatient, our outpatient services. And then we have two long-term programs called the Reprieves. I work specifically for Bradford at Warrior. However, I can help with referrals at any level of care. The pictures that you'll see in this presentation are at our Bradford Warrior campus. This particular photo is taken from behind our main building where all of our patients enter when they come in for treatment, and the big glass windows is the cafeteria. So as you can see, Warrior is a beautiful campus. It's a beautiful location to get sober, and we utilize that part of the campus and outdoors in our therapy. So we do a lot of recreational therapy. We like to keep our patients outside. We have found that people have better outcomes if the more time they get to spend outside. This is another shot of our main building. If you ever come to campus. Most likely we would meet you here. This is where our patients enter the front door there when they enter treatment. So that mentioned detox. Of course, our inpatient programs. So this part of our campus, right up behind this building, we have some cabins. This is where our primary programming is. Typical length of stay is about 21 days. But it depends on the patient, of course, insurance, and their needs as well. So we customize those treatment plans. Sometimes they stay a little longer. And of course, if they go into our long-term program, they stay a good bit longer than the 21 days. This is Limestone Ridge. This is at the top of the hill when you first enter the campus, where there's a security guard up front. At the very top of the hill, we have these cabins. We call that Limestone Ridge. Limestone Ridge is where our veterans program is located, along with our long-term programming, which is 6 to 12 weeks, and our professional program, which is where we treat a lot of medical professionals and licensed professionals like doctors, nurses. We get attorneys, we get therapists, LSCSWs, LPCs, anyone with a license. They would work with our professional program. We have therapists and consultants that will work with them on how to keep or restore their professional license if they've lost that. We also, in our long-term program, we are able to go a lot more in depth. We're doing some other therapy techniques like brain spotting and well, there goes my mind. I don't know if I put it in the presentation. Don't remind me. I don't think I did. But we're using some newer therapeutic techniques that we're not able to do in primary. We do a lot of grief and trauma work in our long-term program. Those are things that we don't really want to dig into in 21 days. But when we have them for 6 to 12 weeks, that allows us to really kind of unfold some of those issues and those things that bring us back into treatment over and over again. If someone's asking, if anyone ever asks me, like, what is an appropriate referral to Limestone Ridge or extended care program, which this is an aerial view of that, of the housing. And then the center building is where our groups are, our therapist office is, and whatnot is there. But if you ask what an appropriate referral, if you have someone who has a lot of grief, a lot of trauma, multiple relapses, I highly recommend this program because we can really dig into what are those underlying issues that keep bringing them back into treatment over and over again. And we can start some of those therapeutic processes that they can continue on discharge with their own clinician that they choose when they in their aftercare program or plan. We also offer PHP. So we recently moved PHP housing to some apartments in Hoover. So ideally, if someone comes into treatment with us, they're going to start in detox. Everybody, to back up, everyone who comes to Warrior is going to start in detox. They may only be there for 24 hours, but we're going to at least keep them for 24 hours just so that we can medically monitor them and make sure no withdrawal symptoms arise. And we do that because for two reasons. Obviously, addicts are not always truthful and they may minimize their drug use, or sometimes they are just genuinely, for lack of a better word, they're just ignorant about their own use. So they may say, well, I'm coming in for alcohol, but what they don't mention is that they have a 30-year history of taking benzodiazepines. So like Xanax or Klonopin, and they don't think it's a problem because it's prescribed to them. They may or may not take it properly. But what they don't realize is that the withdrawal symptoms from the benzos can be just as dangerous, if not more dangerous, than the alcohol withdrawal. So even though they tell us, well, I haven't drank alcohol in a week or two, we see problems like that arise once they get on campus. So we'll hold them there for at least observation for 24 hours. Now, some people may spend a week in detox or better, depending on their withdrawal symptoms and how physically ill they are. But then they're going to move into programming, whether that is primary programming, the 21-day program, or our extended care program. And some people ask, can they come in and do 21 days and then move into extended care? And the answer is yes. However, if we know they're going to go to extended care, we'd like to put them directly into extended care for a number of reasons so that they can do that therapeutic track and just get started with that sooner. A lot of insurances also don't want to cover 6 to 12 weeks of treatment. And so if you go directly into extended care, at least your insurance is going to cover that first 21 to 28 days of that, because the rest of it's going to be private pay. And so that can help significantly reduce the cost of extended care. But so our patients are going to go from detox to their inpatient residential treatment, whether they do 21 days or 6 to 12 weeks. And then we would like them, if they're going to do the full continuum of care, they would go into PHP. And PHP stands for Partial Hospitalization Program. And that just means that they are going to spend the majority of their day in treatment. They're going to go to treatment in the outpatient, at our outpatient office, and they're going to be there for 8 hours a day. And so it is not still residential treatment, because they'll go home. They can either go home or to the apartments that we provide at night. And so they will sleep away from treatment. And then they can move in from, once they complete PHP, into IOP, which is intensive outpatient, and then from intensive outpatient to outpatient. And all that really means is that we start reducing the number of hours that they're spending in treatment as they move through that continuum of care. And then obviously from outpatient, they would continue their aftercare, hopefully attending 12-step meetings and things like that they would have started throughout this process. We do bring 12-step meetings onto campus. They're introduced to Alcoholics Anonymous and Narcotics Anonymous while they are with us. We also welcome other mutual aid groups like Dharma Recovery comes out, or Celebrate Recovery, etc. But we're going to introduce them to those pieces that are going to be important in their aftercare programming while they're still with us. And then we do have our alumni coordinator will work with them as far as we stay in touch with them. We have alumni events so that they can stay connected in that community that they've built throughout this process. A lot of our patients too will go from inpatient residential into like sober living homes that are not owned or operated by Bradford, but a lot of those, especially in the Birmingham area, like even still ALR, Fourth Dimension, a lot of those clients will still be attending outpatient with us. And then some, of course, go into recovery housing that wouldn't attend with us any further. And of course, they can go to outpatient and other programs if they so choose. And these are just some more pictures of our campus. This is one of the cabins. And so when they're there, they really do have a home-like environment. One of the other things that separates Limestone Ridge from our primary program or extended care program from primary programming is we add a lot more life skills. Well, I didn't turn that off, sorry. We add a lot more life skills development. Like in extended care, we give them vouchers and they go to the Piggly Wiggly in Warrior and they do grocery shopping. And then they're going to come back. They'll plan their meals, they'll prepare their meals. So a lot of times when you walk in these cabins, it smells like someone's been cooking. It smells good. It smells like home. They also get day passes and weekend passes to go home, which can be really important. I wish that every patient could do this. If we could ever get insurance companies to understand that, the longer people stay in treatment, the more likely their outcomes are going to be successful. Because I think insurance would save a lot of money if they would just let us do what we do in treatment and let let our patients and our consumers get their full continuum of care, but they don't. And so they will go home, and that's really important because they're going to come back and they're going to process that in group, and I might encounter some challenges on past that Susie doesn't. But Susie's going to hear me process those in group. And maybe when Susie goes home, she may encounter those same things. And so she's going to have that experience that she gained from the group and from everybody going home and processing those situations. So you can imagine how important that is. But those are a couple of the things that are really good. And, some people, if you're not in long-term recovery, which I didn't disclose, but I am always happy to, I'm a person in long-term recovery. Sometimes it's hard for people to grasp why it's important for people to learn how to prepare a meal or go grocery shopping while they're in treatment. But a lot of our clients have never done those things. And that's just one of the pieces of substance use disorder that, as we call others, earth people don't really understand. It just seems so normal and so common sense that you would think any adult would know how to do these things, but we don't always know. Or maybe we were taught them, but we lose those abilities because when you have a substance use disorder, your mind goes into that survival mode, and that's all that they worry about for all of those years. And so these are really skills that they take with them. It builds confidence. It makes them feel like maybe I can go home and be that wife and mother or father and son or just employee or whatever role that they need to enter, in their adult life. We do have, I've already mentioned our specialty programs. I didn't mention our young adults. So in primary programming, we have a young adults program for young men. Typical age is going to be 18 to 25, but sometimes we put older patients in there if it's their first time in treatment. Of course, we have active duty, and then our veterans program is called a Hero's Path. The cool thing about our veterans program is these patients do not have to have insurance. So if you encounter a veteran that is needing substance abuse treatment and they do not have insurance, give me a call. I'll hook them up with our veterans team, and they will hold their hand and walk them through that process. Because it can be a little complicated, but ultimately they're getting treatment at no cost to them, and they're getting to stay in our extended care program. So they're staying 6 to 12 weeks, and we've had veterans that stay up to 20 weeks. And so if you could imagine a veteran that's been experiencing homelessness for many years is going to need a lot of case management to set them up for success when they leave. And we have time to do that with these veterans. So we're seeing a lot of success with that program. This is a picture of our Welcome Center. And by the way, before I forget, I have ADD, so I'm going to bounce around. That's what I do. But if you can come out to campus, I would love to have you anytime, anyone. It's my favorite thing to do, and you would be saving me a day of work because I just get to come show you around Warrior. But I'd love to have you come out and see this campus in person because these pictures are not Photoshopped. It is a beautiful campus, and I think it helps too if you're somebody who refers people to treatment that you can tell them where they're going and what they're going to see when they get there. Our wellness center is like it's a fitness center. It's not like when it is. We have really nice equipment. This is a really important piece. A lot of people exercise and working out, especially men. They love that when they get sober. They can't even, they will say they're not going to come unless they can lift weights. On the other side of our wellness center is our yoga room, and we do yoga. We have our deer feeders are out around our wellness center, and the wellness center has windows all the way around. So a lot of times when you're in there working out or doing yoga, you'll see the wildlife, deer, and raccoons, squirrels, all those things are walking around outside, and it's so cool. This is the main room. This is where everyone enters that I kept mentioning. This is what it looks like inside. In the winter, we'll have the fire going. Family can sit here with them as they complete their intake process. or if family has questions, we'll work with them. And we try to keep family involved throughout the process because it can be so important. As most of us know, the family gets, just as sick as the addict. And so they need some help too, and they need someone to hold hold their hand. We do have a family programming that I can get you that information. I won't talk about that today, but it is free and it's for anyone and it's all virtual. So if you would like that information for someone you know or just to have as a resource in your office, shoot me a text and I will send you the link to that stuff. This is what our cafeteria overlooks this area. Now, Kim's on this call. She's well aware. She worked every day on this campus for many, many years. So, and this campus has been here a long time. This portion, the primary program, the original part of the campus was built in the 70s. So it's older than I am. Warrior's been around a lot of years and had a few different names, and then we have multiple locations. We have 2 inpatient residential programs in Mississippi, one in Tennessee. We recently acquired another facility, which won't be on this list as I move through, in Texas, because it is very recent. And then we have a couple that are up in North Carolina, and one of those being an adolescent boys program. So we really do offer a range of services collectively. A lot of these locations are outpatient locations as well. And we are opening up PHP at many of our outpatient locations currently. So, and our locations are also listed on our website at bradfordhealth.com. And Warrior, we have our own website, which also has a virtual tour option at bradford@warrior.com. So that is all I have for y'all. Let me stop my screen share, maybe. There you go.
All right, thank you, Kendra. So we will go ahead and start with Restoration Springs.
All right, everybody hear me? We're good? Perfect. So Restoration Springs is a men's transitional housing facility that is funded by the Will Bright Foundation. We are currently already a level 3 R certified program, and we are just a month or so away from becoming an ACRM certified program. I accidentally skipped over that slide real quick. Just to tell you a little bit about our why, right there in November of 2012, Will Bright passed away from an overdose after walking away from an aftercare program. Lisa, if you ever meet her, see her in an email, she says the CEO, founder, and mother of the Will Bright Foundation. From his death, it really charged her and her husband, Bill Bright, to start something in that transitional housing space, because that's where Will and so many others struggle. They, like in my case, superstar in treatment, superstar in the inpatient part of recovery programs, but that transitional piece always tend to be a little tough, or an obstacle and a barrier to my recovery, as it was Will's. And I'm going to turn, if the volume comes on this, I'm going to turn it off. So this is just a kind of a virtual tour of our program and our facility and our land. We have 127 acres. We have an 18-acre lake. What you're seeing now is the dorm building that was completed in 2022. We made great efforts to make this feel very at home, a space where men would love to come to and relax, and we can do do small groups in a way that everybody feels comfortable. In the dorm building, we have 4 bedrooms, 2 men per room. Each one of them has 2 bathrooms or 2.5 bathrooms in the dorm. We also have 3 cabins, as you can see right there. One of those is the office. One is our program manager, where he lives. And then we have the one on the far right, as you can see in this picture, is our graduate assistant. When guys graduate our program, they can come or they can continue to stay and help out and just continue to receive services. This is a picture that was taken very early on after the Brights received this property. But I'm sitting right here in this red cabin. Right behind there is where the dorm building was built. Just to the far left in this picture is the pavilion, which are starting the groundwork to make that a community and rec center. The property was donated to us in 2017. The program started somewhere in the middle of 2018. And as I previously stated, the construction of our dorm building was completed in 2022, thanks to a partnership with the University of Alabama and a grant opportunity with the Appalachian Commission, or Regional Commission. So these are just a few things that we try to identify at intake. Let me start off with saying we are a men's program. We are very rural Alabama. We're in Fett, Alabama, which is about, if you're not familiar, about 50 minutes northwest of Tuscaloosa. We serve men of 18 years or older. They can stay in our program for up to 18 months, but we call that a soft back door of 18 months, meaning that some people need additional services. Some people need that additional time. And if they are continuing to work a plan and are making goals and setting goals and completing goals, then we're going to give them that time. Because like I said, the heart of what we do is that transitional piece, and everybody comes to us, as you all know, with different obstacles and barriers to their recovery. Our intake fee is $750, but when someone comes from a program, because we are transitional, we call ourselves the second step in somebody's recovery journey. When somebody comes to us from a program, because we like to have them come from a 90 or plus day program, we can work out the intake fee once they start working at a small increase every week from the normal program fees. Our program fees are $125 a week. If the intake fee is paid in full, there'll be an additional $25 a week that goes into a participant savings account. And when that participant leaves, whether they leave 1 year, 1 month, whatever the case is, they get the entirety of that savings account returned to them to help them with their next steps. And as I previously stated, these are things, just a few of the things that we try to look at intake. Obviously, if they've had previous return to uses, what's been that barrier? What's been the thing that tripped them up in the past? Is it housing? What was their housing situation in the past? Did it contribute to their substance use or to their relapse or return to use? What's their housing plans for when they leave here? Do they have a safe place to go? If they don't, well, let's talk about that and what that looks like and get a plan. Obviously, emotional, spiritual, mental health, physical health. We try to identify all these. We also try to partner with different agencies and different service providers. Northwest Alabama Mental Health, vocational rehabilitation services. Some of the counselors are counseling students out of the University of Alabama. Just whatever we can do to make sure that each part of this person's life is being tended to make sure there's no barriers to their recovery. Obviously, like Kendra stated, financial resources, but also financial learning and life skills in that area. Educational, we have a partnership with Bevel State that has adult services. Vocational, we have a partnership with the West Alabama Works and with the Fett Career Center. And we are a faith-based program as well. So we go to church on Sundays, we go to CR meetings on Thursdays, we do small groups during the week as well. And then we also, whatever AA and NA meetings are in our area, we provide transportation to those at no cost. We provide transportation to and from work for all of our participants at no cost. As the CEO says, as long as we can. That's just another commitment that we've made to remove a barrier from everyone's recovery that comes through our program. The life plan, these are just areas that have been identified. I took this from a previous place of employment with permission to use this to just help people to learn what a good foundation will look like. Some things that you can do to help you start experiencing those small successes and gain momentum towards your moving on with your life. And that is our program in a nutshell.
All right, does anyone have any questions for Restoration Springs? You can either say them or put them in the chat, either or. All right, so we'll go ahead and move on. And lastly, we will hear from Partnership for Drug-Free Community.
I'm sorry, hold on. Okay. Okay. Is it up? Am I going? Okay. So, my name is Kim Lamar. I am the Recovery Resource Hub Administrator for Partnership for a Drug-Free Community. And there's actually the Partnerships Recovery Resource Hub, which is the hub that I'm over. So, and I will explain that as we go along. So, Partnership is a nonprofit dedicated to creating a healthier, drug free community in Northern Alabama. We empower youth through drug, alcohol, and tobacco education and prevention programs and offer adult recovery resources and treatment referrals, all at no cost. All of our services are free to our clients. So Partnership for a Drug-Free Community was founded in 1988. Actually, in 2019, at the height of the opioid epidemic, Partnership opened up the Recovery Resource Hub to provide recovery support services to individuals in Madison County as a one-stop location for individuals and their families to come and find assistance with substance use disorder. So actually on February the 3rd of 2020, right at the beginning of the pandemic, I worked for another treatment program and Partnership for a Drug-Free Community in the Huntsville area, pretty much the whole northern area, and also Recovery Resource Center in the Birmingham area. We were the only ones providing free ASAM state assessments for individuals going into treatment. So I I partake of partnership services early on as a peer support specialist. Um, so one thing that we provide is no cost in person or virtual state ASAM assessments to access state certified treatment options. Um, so if the reason we do the virtual assessments is to help those that have that barrier of transportation to getting in person to have that assessment. We prefer to do it in person because we like the personal, the relationships that we develop with our clients. But as a lot of us know, transportation is a barrier in our state. Another thing that we provide is case management. So a lot of the people that we serve are uninsured, underinsured, homeless, but which we have seen an increase in people that are housed partaking in our services. But primarily we do treat the underserved, uninsured. So a lot of people that come in, our clients come in, they may not have anywhere to stay tonight. They may not have anything to eat. Um, they may, they may need resources for lots of different things. Like we have resources and to help them with, to get signed up with insurance, like through the marketplace and things like that. So we have a case manager that works with our clients on that. And also we have recovery support services at no cost. So once that assessment is completed, and we typically send it out to 3 or more, it depends on what the client, we do let them have a say in where they want to go because it is ultimately up to them, so at least 3 or more facilities that are state certified that it's going to be at no cost to the patient or to the client. So once that assessment goes out, peer support begins following up, making sure that the assessment was received by the program, and also to keep the peer motivated because there is a waiting list in Alabama at most of the state certified agencies. So support, motivation is a huge part in someone's success. Say they haven't used when they come in 2 weeks, but they want to go to residential. We'll say in 2 days they continue back to use. So we've got to go back and help that person get into like free detox or other options. The assessment is the small part of someone's recovery, but it is the first part if you don't have insurance or if you're underinsured. We have clients that have insurance, but sometimes that insurance may not pay for residential or even detox. So we do assessments on people that have insurance if their insurance does not cover that care that they need. So I agree with Kendra on that. If we could just get the insurance companies on board with all of us, we would be set in the state of Alabama. So we offer resources and referrals for clients and their families. So we partner with Not One More Alabama, which they are literally across the street from us. So when we have clients that come in, and especially if their families are with them, then we automatically make the referral because right across the street, NOMA does I think it's on Tuesday night, a family support group, and So we really partner with anybody that we can to help the clients that we serve and their families. We volunteered with the Noma Walk on Saturday, and our some of our clients showed up with their families to also volunteer. So it was really, really, really awesome to see that. So, the Recovery Resource Hub is now offering assessments and recovery support services at no cost in the following counties. Cheryl Russell is our executive director, and she, this was a vision for her to be able to expand our services into the counties that surround us, because we get so many calls from those counties, transportation being an issue, um, and things like that. So now we can do that, and we are actually in the process of meeting with people in those counties, to partner and let us come in and help. Let us come in and set up and do free state assessments for the people in your community that need it. So the counties are going to be Jackson, Limestone, Marshall, and Morgan. So if anyone on here is from those counties, please reach out to us and let us know if there's any way that we can help, how we can partner together. So yeah, we're very excited about that. So our referral process. So if you have someone that needs a free state assessment or referrals, any type of resources, please call 256-539-7339. And we actually just moved. We had our grand opening ribbon cutting Thursday. No, Friday. I'm sorry, Friday. And it was a huge turnout. So we were really, really excited about that. So let's see. And also, so that is Cheryl Russell, our executive director, and she's holding up a sign, and it's our new campaign that we are going to be placing in all the bus stops in Huntsville, and actually behind the bus driver's seats in the buses in Madison County. And so we came up with, have you asked for help yet? It didn't seem as warm and inviting as, are you addicted? And things like that. So that was actually about a 2 or 3 staff meeting decision on what can we put on there that, is warm and inviting, and it feels good. So, and that's actually our new location, right behind Cheryl, and that was our ribbon cutting that day. And also our community partners, we partner with law enforcement. We work closely with Chief Giles, Chief Gandy, Sheriff Kevin Turner, Mayor Battle, Mayor Finley, and County Commission Chair Mac McCutcheon, Rex Reynolds, Representative and Senator Arthur Orr. We work really close with Ross here in Huntsville, also Noma, and I mean, anywhere we can partner and help, we are always willing to do that. Let's see. And this was also at our ribbon cutting Thursday. So we're very, very glad that it was such a good turnout. And we also we love our volunteers. On the far left, that's our peer support specialist, Tony Stillman, and then some of our volunteers there. So if you know anyone that would like to do some volunteering hours with us, please reach out. We have so many options, and we're always looking for people's strengths, and to help them because it helps to help others. And I'm sure that's our common goal here. And so this is my contact information. Um, I've got that is my personal cell phone number, and then my email is there as well. And thank you for having us, to do this presentation. And thank you for everything that everybody does on this. We appreciate everybody. And if
Thank
y'all have
you.
any questions,
Yes, if anyone has any questions, they can ask now or put them in the chat, either or. All right. So, if anyone doesn't have any questions, we'll finish up. So, thank you for joining. We hope you were able to learn something new about a resource available to you in Alabama for treatment and recovery. Please join us on September 4th for our next virtual meeting and have a great day. Thank you, everyone.